Nissy. Hi, I'm Shafira.
Hi, I'm Connor Williamson.
And I'm Roy Montenegro, and we're going to be doing the Canadian healthcare system, and we're going to go ahead and let Connor start us off.
So, we'll start by talking about the healthcare system in general. Canadian's healthcare system is publicly funded, single-payer healthcare system, meaning that one source is funding it, the government. And unlike America, where there's multiple sources like employers or the government, we just have one source in Canada paying for it. There are 13 provinces and territories in Canada, and each are responsible for organizing and delivering the healthcare services. The federal government oversees and makes sure that this budget that they give them is being sent and given to all these different areas that they find important. And then, of course, the provinces decide what is covered and then how people get insured by that province. And then the next thing is that it covers medical necessity, like I was talking about. And so each province has a different list of things. So there's things that are obviously always covered, but then provinces can always vary for what they think is covered or not covered. And so after that, you have the system is primarily funded through taxpayers. And so that means that me, you, anyone who's working in Canada is going to be paying a share of their money to the federal government, like we do with Medicaid and Medicare. And of course, this means that since the single-payer healthcare system universal, and how they do it is that it's not based on use. It's based on just your income and how much you're paying toward this system. So if you're not even using it, you could be paying a lot more than someone who is using it a lot and isn't spending a lot on it. Physicians are paid by a negotiated fee for service, and hospitals are paid through a global budget. And that global budget kind of also explains in a little bit of a way of why Canada is so focused on the preventative measures and the tested measures that we see, the Canadian C-spine rules, the Ottawa ankle and knee rules. They're all ways to prevent Canada from spending money, excess money on x-rays that aren't necessary. If they can prevent a patient from using an x-ray when they don't need it, then that's money saved for the hospital. And so also private insurance is available to purchase. Whoever wants it can buy that. And a lot of people who want full coverage will go for that method, because dental insurance, for example, is not covered. It's not a medical necessity. And so a lot of people are paying for both the private insurance and also the publicly funded single-payer healthcare insurance. So, yeah.
All right, next we'll be talking about the advantages of the Canadian healthcare system. One of the advantages to the Canadian healthcare system is that all Canadian citizens are eligible for healthcare. So regardless of how much money they make, regardless of their medical history, and even regardless of their standard of living, all citizens are eligible for healthcare. So that is an advantage. That's a bonus. Also, physicians and other healthcare providers are given more autonomy. So just alluding to what we mentioned earlier, how physicians have a budget. The hospital has a budget. So they have to abide by this budget. But because they don't want to spend money and they want to be more efficient, they have the right to choose which services they provide to each patient. So that allows them a bit more autonomy as far as what they do for each patient. Another advantage to the Canadian healthcare system is that there are no co-payments or even other fees. And the public is insured. The government and the healthcare provider, they negotiate the costs out themselves. Also, all citizens, as we said before, are eligible for healthcare, and they receive what's called a provincial card. And on this card, they have an ID number, and this ID number makes it more accessible. It makes it easy for all healthcare professionals to be able to find medical history, so that way you're not trying to search in different databases or trying to get things faxed in. Everybody just has their one card, and their ID number has all of their medical history. And lastly, even if they're not a Canadian citizen, so those members, for instance, that might be immigrants or undocumented immigrants, illegal immigrants, or even temporary visitors that might have stayed longer than they were supposed to, past their date, they can also get insurance, but they'll have limited benefits. So they won't have nearly as many benefits as those that are the citizens, but they still can have healthcare coverage. So those are the advantages for the Canadian healthcare system.
So next thing we're going to head and talk about the disadvantages of the healthcare system. So of course, what we were just talking about, they do have to pay higher taxes because of course this is a budget system in which everybody has to pay into so they can actually get their resources. Of course, this is not based on the use, so, as we just talked about. So no matter how much you're paying, you're going to get the same service regardless. However, it does not mean you're going to have to use it all the time. One of the big downfalls is that it being a free service, everybody wants to use that service. So there's been a lot of waiting times for surgeries, diagnostic procedures, which are becoming quite common in Canada, which is actually making it very hard for them to get that treatment. And then, of course, some things are not deemed necessity. So some procedures, like what we're just talking about, dental care, eye care, can also not be seen. Even prescription drugs are even not being there, so they're considered a supplemental insurance, whereas needed just to fund for that. So just a couple of statistics that were found were the average wait time for any kind of treatment is almost 13 weeks. So a lot of these patients are not getting what they need right away. So even though it is free and they're gonna get it, they still have to wait a long time for that. And then some statistics were also saying, even the doctors up there were saying it's 80% longer than clinically reasonable, which leads to vulnerable people such as the elderly with cataracts are not actually getting their surgery they need, and they're actually getting temporary blindness until they actually get it. So these are just some of the disadvantages of what we have for the Canadian system. And then for the American system, basically, there's only a couple things that are very different. So American system, it's mixed governmental and private insurance. So depending on how much you're paying from out of pocket to your place of employment will give you knowing how much insurance you will get. We do pay taxes as well for our healthcare, but we do not see that till much later in life. So our Medicare, Part A, Part B, our Medicaid, we don't end up seeing that till almost 65. And then, of course, we do have much more available access to certain high-tech imaging. Because just another more statistics that for every million Canadians, there's only about 9 MRI machines, which is attributing to their long wait times. For instance, in America, there's almost 33 machines for every million person. And this is just some of the big differences between each. Let's go to the next.
All right, so now we're going to talk about the U.S.'s healthcare system versus Canada's healthcare system. So a big thing is Canadians have higher taxes for their healthcare system versus Americans, and a big reason for this, or similarity that we can compare it to in America, is how we pay for Medicare. So when we work, a portion of our money is going to go to help pay for that. But in Canada versus Medicare in the U.S., where it's only a certain group of people that qualify for it, in Canada, they're paying for everybody. So they're going to be paying a lot more taxes than we do here in America. Another thing is America has more citizens that don't have insurance, and that's because, again, they don't have that universal health care like they do in Canada. And just like Romy was talking about, wait times for surgeries and other diagnostic procedures are going to be much shorter in America, and that's, again, because of the global healthcare system, or healthcare system universal to Canada. So that's going to cause a lot of people to need procedures and be more willing to go because it is free for them, and that's also going to increase the wait time, which can be seen as a negative. Unlike America, where we have much more access to things, wait time is going to be a lot less in America compared to Canada. And again, Americans have to pay co-payments and out-of-pocket expenses, versus in Canada, the expenses are covered much more differently because of the universal healthcare system. There's going to be only certain things that Canadians are going to have to pay for, like dental care, vision care, and certain prescriptions that Romy just previously discussed. And private insurance in the U.S. is what is mainly used for healthcare, versus in Canada, they have that global healthcare. So those are just some major differences in Canada versus the U.S.
So next, we have some improvements from Canada to the U.S. I'm sorry. Some things that the U.S. could probably take away from Canada's healthcare system. The U.S. should focus more on screening and conservative testing. Like we mentioned earlier, Canada has the Canadian ceasefire rules or the Ottawa ankle rules, which allows for a more efficient way of screening people and less money spent. So that's definitely a bonus. So that's something that we can learn from. Also, the U.S. health system is highly disliked by most of the population. A lot of our U.S. citizens think that we spend a lot of money on healthcare, which is true. So 90%, here are some statistics for you, 90% of respondents of a survey indicated that minor or some fundamental changes are needed to improve our healthcare access. Also, I'm sorry, that was in Canada, so I'm sorry. While 76% of American respondents of the survey believe that our healthcare system needs fundamental changes to complete overhaul. And lastly, Canada has a much lower healthcare cost and drug costs for their population. So these are some things that we can just take away from their healthcare system and bring it to ours and hopefully make it more efficient. And then one takeaway that we do have for our presentation, one thing to mention, one thing that's very important is that because they do allow all citizens to be covered by healthcare, or they have all citizens are health insured, it allows for a lower mortality rate, lower obesity rate, and even lower rates in different diseases like cardiovascular or diabetes, things of this nature, more serious illnesses.
And then just one other key takeaway that I think is really important to remember. Although it does seem like Canada's healthcare system does have a lot of advantages, the big disadvantage is just the long wait time. So that's something that we don't have to deal with in America just because we don't have that universal healthcare. So although this sounds like a great plan, there are always going to be some cons to any healthcare plan. No healthcare plan is perfect, and that's just something to keep in mind when comparing the U.S. to Canada. So this concludes our presentation on Canadian healthcare. Thank you for listening.
We have like 12 minutes.
12 minutes, 30 seconds.
Wait, it's still on.
Yeah, that's the only thing.